All right, we are live for our series on creativity and media as resistance on the creative imposter. I am here with Jennie Wetter from RePROS Fight Back. If you don't know me, I'm Andrea Klunder. I am your producer, host, editor of The Creative Imposter. And this series was kind of an idea that was sparked for me this year when I did not feel very creative because the world feels like it is on fire, crumbling. I don't even know what all the disaster scenarios could be that are happening right now in this space. And that was causing me to feel really down, really frustrated, really like, what is the point of making a podcast when all of this stuff is happening in our country? And the inspiration that was sparked for me is okay, I don't know what to do. I don't feel like doing anything, even though in my heart I want to do something. But I have a very dynamic, creative, inspiring network of people who are taking action, who are using their resources, using their platforms, using their creativity to make a positive difference and to try to continue to shift society forward in the direction that I personally want to see happen, which is great. And Jennie Wetter is one of those people who has been in my orbit in Podlandia for quite some time. We've been in some
Yeah.
mentoring programs together. We've been at some awards programs together. And I've never actually gotten a chance to sit down one-on-one for 45 minutes to an hour to talk about all things podcasting and RePROS Fight Back. And for those who might not fully get the reference or maybe didn't look at the title of this live stream, what does that title mean, Jennie? What is RePROS Fight Back?
Yeah. So RePROS Fight Back is a podcast. We talk about issues related to sexual reproductive health rights and justice. Kind of anything that falls into that sphere. We want to make sure that people are aware of what's happening and not just like, here's this new terrible thing that's happening. But it was really important to me as we were doing this that, like, yes, it's important people know what's going on, but it is also important that they know here's what you can do to fight back and what you can do to make a difference.
Can you tell me what does reproductive justice mean?
Yes. So, very big thing, but has kind of a really clear, I think, definition. It is the ability to decide to have a family or not have a family and to raise them in a healthy and safe environment, right? Seems like a really simple concept, but so many things fall under that, right? It's not just about bodily autonomy, but when you talk about a healthy, safe environment, right? That can be things relating to the actual environment. It can be gun safety. Like, it is a huge concept that covers so many things. But it is really kind of that marrying of reproductive rights and social justice and having this true justice based conversation.
I feel like in this category, a lot of times the emphasis is focused so much on the abortion issue. Like that becomes the centerpiece that becomes very controversial and divisive and becomes the political, I don't want to say chess piece because I feel like that's giving dumb people too much credit, but becomes the political chip that's getting moved around the board. And I was thinking about this listening to a conversation about Planned Parenthood, for example, as an organization. And I was like, everybody, everybody, people often negatively associate Planned Parenthood with abortion. And I'm like, I have personally have gotten so much benefit from Planned Parenthood, and in Chicago, also another local nonprofit called the Chicago Women's Health Center, which provides a lot of similar services, just in a different format for my own like women's health that has nothing to do with being pregnant or not being pregnant or having a baby or not having a baby. Specifically when I was having financial struggles and could not afford health insurance. Being a self-employed person, I do not get health insurance from anyone, and especially in the pre-Affordable Health Care Act, I flat out could not purchase health insurance. I just couldn't do it. And these organizations were the only places that I could go to make sure that, oh, you have an extremely painful UTI. Where do you go to get that diagnosed and get antibiotics? Planned Parenthood, right? Like, oh, I would like to have contraception because I would not like to have an unplanned parenthood. So where do I get that in an affordable manner? And these organizations have been so important to me in that regard as well, that I think some people just have this tunnel vision of like, um, that it's this one thing only, and not just all of the resources that organizations like Planned Parenthood or the Chicago Women's Health Center or any of these other reproductive health centers may provide.
Yeah, and I think also that conversation becomes, is abortion legal or not? And it's so much bigger than that, right? Because even when it is legal, that does not always make it accessible, right? The closest clinic may not be close to you. You may not be able to afford it. You just were talking about affordability struggles. You may not be able to travel to get to it and take time off of work. But this also applies to all of those other services you were talking about. So when we talk about sexual and reproductive health, we're talking about a whole gamut of issues. And that's what we talk about on the podcast, is kind of this full range of issues, whether that's abortion, birth control, sex education, maternal health, Black maternal health. We are in the midst of a Black maternal mortality crisis. Restrictions on abortion, slashing Medicaid is only going to make all of that worse. All of these things are interconnected. It also means talking about sexually transmitted infections, intimate partner violence or gender based violence. It's also LGBTQ issues or trans rights issues. This is a huge area that has so many things that we need to talk about. And so it was really important when I started doing this podcast. We started during the first Trump administration, and there were so many attacks happening around issues that we work on, around sexual and reproductive health. That we wanted to create the podcast to kind of fill in that gap, to help people keep up with what was happening, to make sure they were informed and then give them a way to fight back. And that has only become so much worse as like Trump won. We talked about everything being on fire all at once. And normally we were used to putting out like a fire here or there, but we never had a chance to catch a breath, right? So the end of Trump one was COVID and dealing with all of those things that were happening around COVID. And then the Supreme Court overturned Roe v. Wade, which meant the loss of federal abortion rights. So then that was like this whole new crisis and trying to ensure that people were still able to access the care they need. And then came the new administration and this all out assault on sexual and reproductive health, but also on so many other areas that we care about. And it just, eh, there were so many things that, like, you can even use the fire analogy anymore, right? Because like, not just was everything on fire, but like it was like these new fires that you had no idea how to handle. So there's just so much going on. And again, sexual and reproductive health is such this broad category of things that need to be talked about, that abortion does get the bulk of the attention, but there are so many other things that are important and that we need to talk about at the same time.
Okay, so I am, hold on, let me see if it will let me do it. Okay. Uh, oops, add stage. Here's your website for the podcast and some of
Yes.
the episodes. So I'm looking at Now is the Time to Defend All Abortions. Title X Health Centers Share the Impacts of Withheld Funds. Medina versus Planned Parenthood is a directive attack on reproductive justice. Maybe that's the episode actually that I was listening to when I was thinking about Planned Parenthood. A finished term, decided Supreme Court cases impacting LGBTQI plus and repro rights. Like, with this onslaught
Yeah.
of issues, it's like, I hate to use this now cliched term of like fire hose of issues with everything that is happening in this world. How, so harmful policies, rescissions and funding, appointments to judgeships and federal offices, um, actions, propaganda, media coming from the current administration. Like, who who is being harmed? Who is benefiting? And how do we know where to focus? That could take like 5 hours for you to answer, but
Yeah, it's so hard, and I think what it comes down to is you can't focus on everything all at once, like, you are gonna
Mhm,
burn out that way, but you need to engage in areas where it is important to you. So,
mhm,
I'm not always great about I always feel like I need to do all the things, but you don't need
right.
to do all the things. Pick a couple that are important to you and keep up on what is happening and find ways to get involved. So, when I think about what is happening right now, a lot of my attention is focused on the new administration dismantled the US Agency for International Development, USAID. That was our aid assistance program. That was food, water, huge global health programs. They're all gone now, mostly. There's like a little tiny bit of it remaining doing some things. This is like life-saving care that was part of they talk about it as a three-legged stool: defense, diplomacy, and development, and then they are all important together, and it keeps everything stable because you have this three-legged stool. So you need all of it to make sure that everything is safe, uh and we just got rid of the development one. And like that is going to have huge repercussions. People are already dying. We know this. We know this is going to have huge implications. And when we talk about sexual and reproductive health, we know that 1 year without international family planning is going to lead to over 34,000 preventable maternal deaths. Like that is a choice that we have made. And it was done by Doge saying that this was waste, fraud, and abuse, blah, 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 blah. It's not. It was life-saving assistance. And if you want to talk about waste, fraud, and abuse, right now, the administration is looking to burn about $10 million worth of contraceptives instead of selling them or to other aid agencies or aid recipients who could make sure that those contraceptives got to the people who need them for life-saving healthcare. But instead, they are going to burn them, which is the ultimate waste, fraud, and abuse, to spend money to burn money that was already spent.
Did I see on social media that now happened? I think I might have seen something today. And again, I don't know if I can always trust what
Oh
I'm seeing
man.
on social media.
It is very possible. I had not seen that yet, but I have also been doing other things today, so I have not been on top of my emails, but I have not seen that it was actually happening, but I know it's imminent and there's a lot of pressure to try and stop that from happening.
I can't like I cannot wrap my mind around why.
Yeah, I mean, they
Like
already
I just
burned
can't.
I think it was like, I wanna say $50 million worth of food, don't quote me on that. It was a lot. They burned food assistance instead of getting it to people who are starving, and it was food that was already bought from US farmers. Like, this is not just things that are happening and are gonna impact people around the world. There are repercussions. There are companies in the US who are producing products that were being sold and going to these aid programs. US farmers were able to sell surplus to USAID that was then exported. Like there are going to be huge consequences for this decision to get rid of USAID.
And so who is benefiting from these decisions?
Right? I honestly, I don't know who is benefiting from this because I just cannot imagine like they're using it to score political points, and these are people's lives, and it's devastating. And I think of that through as we were talking about, these other things that are happening. The other one that is really sitting heavy on me, one is the attack on trans rights, but I think I want to talk a little bit more instead about the attack on Medicaid. This is absolutely devastating. I hate saying it because it makes me feel dumber every time I say it. But the big beautiful bill that was passed, I know it hurts. It's like,
It's
but
painful.
it is the official name, and like it hurts. Uh really slashes Medicaid funding, and could leave 16 million people without healthcare. 16 million people are going to lose healthcare. 50% of births in the country are funded by Medicaid. This is going to have huge implications on people's lives and their ability to access healthcare, and it may impact you as well, right? You may not be on Medicaid, but the hospital that you go to sees patients on Medicaid, and that is an important point in, like, keeping the system together and how they cobble their funding to keep the hospital open. We're going to see particular impacts with rural hospitals where they are not going to be able to stay open if they lose all of the funding that they are getting from Medicaid to see patients with low incomes. As somebody who grew up in a rural area, the hospital that I went to as a kid, the Beloit Memorial Hospital, is considered a rural hospital. It could have huge implications on the hospital that I grew up going to, and so many more across the country. And so, people may not think of where I'm from, the city itself, as rural, but it is considered a rural hospital. So the hospital where you go may also be considered a rural hospital. And it may impact your ability to see providers that you want to see. It may force the clinic to close or close departments. This is going to have huge implications on everybody. And again, who is this benefiting? It's benefiting the wealthy who are getting the tax breaks from this slashing of funds for a program that majority benefited those with low incomes, people of color. Like, this is huge, and it is going to, again, it is going to destroy lives.
It's another thing that feels very personal to me because during, in part of that time when I was struggling financially and trying to find my footing, and there was a period in which I had a failed business and had to file bankruptcy, and I did make use of Medicaid for a period of time. I think there's a stigma sometimes, like even when somebody suggested to me that I could apply for Medicaid, I was like, "Oh, certainly not me. Certainly certainly that's not for me. Like, I don't need that."
And
And
you might not know you're on Medicaid is the other thing, because Medicaid is funded
mm,
by the federal government, but it is managed at the state level. So in Wisconsin, that means if you're on Badger Care, you're on Medicaid. So you
mm,
that may not be the name of the program that is on your insurance card, but it could be Medicaid.
right, being funded. Yeah, and like I will say that I at the time that I was on Medicaid, it did save my life because I had a breast cancer diagnosis at that time. And I can promise you, I would not have been able to afford those bills if I did not have that coverage. There's no way. So it quite literally is a program that saved my life. And I I just yeah, it hurts because I know how much I have benefited from that and how life-saving it can be and what like quite honestly what a life or death situation it is for people. And then when you look at the numbers of like how much money we are saving by gutting this program versus how much we are spending on other programs that are completely unnecessary at best and incredibly harmful, more accurately, like the ICE budget or et cetera, et cetera. It just is hard to wrap my mind around. And I'm wondering, like, for you being here doing this work and talking about these issues day in and day out and researching and knowing all about what's happening, how do you how do you do this work without losing your mind?
Well, here comes one answer. I have a cat who is about to show up. She's maybe second guessing this one. We'll see. Um, I I focus on the big picture a little bit more than the, like, thinking about the people who are impacted, because, I talk about this when I talk about what gives me hope working on abortion. And if I think of all of the people who are being turned away from the care they want, that is the way that will break me. Um, because that is changing their lives forever. not being able to get the access to the healthcare they need. So I look at what is being done. And so that is looking at the amazing work of abortion funds and what they are doing to ensure that people who need money to be able to access the care they need, who need to travel to access that care, are able to do it. The amazing work that clinics are doing to ensure that people are able to get the care they need, even if it's not at their clinic, because they can no longer provide that service. So those are like the work related things that give me hope, is seeing that amazing work that is being done. I read a lot, and like I have found, and I generally read kind of all over like, again, massive reader, read all over the place. But I have found as things have gotten more stressful, and life happening in ways that are complicated and stressful, I have been turning more and more to reading romance, because that is like, it has a happy ending. That is the level of stress I can take in, like, outside of work, because there's all of that work stress. So this book will have a happy ending, and I
You're
know
the
it will.
opposite of me, Jenny. When I get stressed and the world is overwhelming, I watch the darkest media and read, like, I find like the most like psychological thriller, like
I
everyone
do
ends up
that too.
mad or dead by the end kind
Yeah,
of
or
thing.
dystopia, like, I will definitely read dystopia as well, or watch movies like that. The other thing, if you hear me say I'm watching The Great British Baking Show, I'm in a dark
Oh,
place, and, like, I
that's
need the,
comfort
like,
food.
yeah, that's the, like, things are bad, I need the happy thing. And then I also bake. So that is my other thing, and I have cats who like to join calls.
Who is this one?
This is Cinder.
Hi,
Buddy, can you
Cinder.
go lay down, please? Oh, well, you can
Aw,
talk.
straight into the mic.
I know.
This is really
Okay,
funny.
thank you. Go lay down. You made your appearance. Okay,
I
sorry.
appreciate that was just for me. I'm a cat person and I don't have my own. So
They really, with the pandemic and working from home, they have decided that their career is Zoom diva, so they love to be on camera when I am on camera.
amazing. Um, so that's how you take care of yourself personally. And the work that you're doing with RePROS Fight Back, you've described it as both a podcast, which I have listened to and which folks can listen to in their favorite podcast app of choice, and also an initiative. Can you talk a little bit more about um, why a podcast? Like, what can a podcast possibly do?
Yeah. So, like I said, we started the podcast during the Trump administration, and the first one, and I think I also really love to tell this story, because when I really love my old boss, but this was one of those things that came up during a board meeting, where, sometimes great ideas get thrown out and you're like, really? And one of them was like, well, why didn't you all just start a podcast? And I was like, that, no, that sounds terrible. And like a week later, my boss comes into my office and he's like, well, let's talk about this podcast idea that came up. And I think that you should do it. And my immediate answer was, I don't think so. That sounds like a terrible idea. I do not want
Because
to do
you
this.
because you weren't into the podcast idea, or you just didn't want to be a podcast host?
A little bit of both.
Okay.
Like, so another thing about me, one, I work for a nonprofit, but two, my mom was a banker, and so I very much had that, like, upbringing of, like, if you're gonna put all this money in, like, what are you gonna get out of it? And so my brain was working the, like, "Well, this just seems like we're throwing a lot of money at," and the thought of hosting a podcast, I'm an introvert, which I think is very common among podcasters, but also, like, I couldn't imagine being the, like, face in person. And my boss was like, no, I think you should do this. I think you'd be amazing. Like, Jenny, you need to do this. And like, after so much pushing and pulling, he never wavered in his confidence that I should do this, and that he saw me excelling at this, and that this is something I should really do. And then he let me run with it and craft the podcast that I dreamed of or envisioned, once he convinced me that we needed to do this. And so I wanted to make sure that we were giving people the information they need so they understood what was happening, because again, there were so many things happening all at once, kind of like now, maybe more so like now. And that, but people didn't want to paralyze people with the like, this is all terrible, and wanted to make sure that once people were informed, they were empowered to take action. So I always end each episode asking the guests, like, how can our audience get involved? What can they do to fight back in this moment? And we've gotten so many amazing suggestions over the years, big and small. Have conversations with your friends, to donating money, to calling your member of Congress, like a huge slew of ideas. And I think that is so important, to give the power to the audience to, one, know what is happening, and then give them ways that they can fight back at this moment.
Do you have any? I didn't ask you this in advance, so it's a little bit not fair. So if nothing comes to your mind, it's totally fine. But do you have any, like, I don't want to say success stories. I want to say any incredible moments or feedback or anything that has happened, or a connection that has been made as a result of the podcast over the years that like feels very meaningful to you?
Yeah, I feel like I've had one. We go every year to a couple conferences that are not podcast conference, but more issue related. So we go to the American Public Health Association annual conference, and the National Family Planning and Reproductive Health annual conference, and getting to meet people who listen and are so excited to talk about it and talk about things we've talked about it and meet me is like amazing and surreal, and all of those things at the same time. I've also gotten emails from people who have talked about how important it was to them in shaping their thinking around these issues. Somebody who decided that this was going to be their specialty in med school, like
Mm.
things that like I couldn't imagine happening. And also getting to talk to people that I wouldn't have imagined getting to talk to. One of the people that I could have never imagined reaching out to and being like, "Hey, would you come on the podcast?" I got to talk to Dr. Dorothy Roberts on the podcast. She wrote Killing the Black Body, but we talked to her about her book Torn Apart, talking about the child welfare system, which was horrifying and amazing. And it was so wonderful to get to speak to her. But I've had so many guests that I just feel so lucky to be able to talk about. And then the other thing I really love is quite a few of the guests are people I work with day to day. And I love getting to show off the amazing community that I work with and how smart so many of these people are, and the amazing work that they are doing. Like, that just makes me happy that I get to show them off as well.
I think that's an often overlooked or underrated value of podcasting is not just the interaction between you and the audience, or the end result or the end media product, but actually the connection and relationship building that happens in conversation in the moment that you are having that conversation and having that dialogue and creating those. Oh my gosh, why is my head so full of cliches today? This is really a curse. I'm like, all those synergies. Um,
Yeah.
but really quite I saw this somebody posted something on LinkedIn, not as satire, but in all seriousness, that was, hey, do you ever notice how when your company makes a podcast, you might have low numbers of people watching or listening to the podcast, but you get high numbers on social media of people watching the clips? What if instead of wasting time recording a whole
No.
podcast episode, you just got together and recorded clips for social media?
Yes, because the clips they just came out as clips. It wasn't a because of the in-depth conversation you had that you could pull a couple clips
Correct.
from.
And I was like, is this satire? No, this is serious. This is really somebody's brilliant idea.
And you never know where those moments are gonna happen. we did an episode talking about gender-based violence, but I also think sexual violence in the Indigenous community and the ways that the U.S. government is not doing enough and not living up to their commitments. And I talked to a friend at Amnesty, but before that, I talked to a Native advocate called Jessica Burkett. Oh, don't quote me on that last name though. And we had such an amazing conversation that I didn't expect, and I can tell she works with survivors because she just has this presence and that just like pulled all of this like heartfelt conversation from me about like my experience, and that was something you could have never planned or saw coming. And
Or a
that,
comms
you
professional
find these
scripts it for
moments.
you ahead of time.
Yeah.
Yeah. Fascinating. What is So these are some of the things that have been working for you, and I'm going to ask you the question that I already know you're still working on defining, because we have talked about this before,
Yes.
is what is so what does dece blah, blah, blah. Hi, words. This is the curse of being live. Okay. What does success look like for RePROS Fight Back? Like, what would you like to see? What is your vision? There's a part of me that's like, well, the vision would be that you don't need the podcast anymore,
Yeah,
right?
right? So I definitely took notes and like had like real thought out answers, but there's currently a cat sleeping on my notes. So let's see what I remember. I think one of the things of success that was important to me was that we were going to do this podcast, but I didn't want it to be seen as something that my organization was doing. I wanted it to be a resource for our community, something that highlighted the work of all of the amazing people I worked with, the issues we care about, getting to highlight those organizations and the people I work with, and have it be seen as a resource by my community. And from things I have heard from friends and colleagues, I think we have really been successful in that area. And honestly, there's no better measure of success for me personally than to have people I respect and care about so much see the value in what we are trying to do. And so that makes a huge difference to me. I also hope that, and I know this is not something you can like necessarily measure. So like, is it success if you can't measure it? But what was really important to me is that we maybe converted people who care about these issues and are learning about these issues into people who are taking action on these issues. That is like where I'm hoping the podcast is making a difference each week. These people are learning more about these issues and ways that they can get involved, and that is inspiring them to take action in some small way. And I think everybody has their place where they can be involved in this moment. So that does not mean that you have to donate and be at the protests and talking to everybody and making posters or doing these other like all of these any million of other things. Everybody has their lane in ways that they can bring things to the movement. So maybe it's volunteering at a clinic, maybe it is making phone calls, maybe it's donating, like maybe it's a couple of those things or something else. You're a graphic designer, maybe you reach out to your local abortion fund or clinic and they need somebody to do some designs for them. I think there are so many ways that you can take your current talent and get involved. And if our podcast can inspire people to find their way to get involved in this moment, that would be amazing. I feel like I
And
had another one, but I don't remember.
I have one.
Yeah.
Your new merch store.
Yes. We do have a new merch store. We had an amazing designer that we have worked with. If you're in the repro space, you've probably seen her around. Liberal Jane. She designs really cute, fun designs. We had her design some stuff that we've had for stickers for years and have given them out at conferences. We finally turned them into like t-shirts and water bottles and bags and things like that. They say things like reproductive rights are human rights, fund abortion, fight evil. Abortion is a human right, not a dirty word. So many fun things. I love our new merch, and I hope people can now wear their support for repros. There we go.
So there's some of the new designs, and I mean that was kind of a corny transition, I will admit, but um, what the reason why I bring it up as like something small that you can do is not only does it support RePROS Fight Back in the Population Institute, but also it's a conversation starter, right?
Yeah.
Because I think that a lot of times we've sort of underestimated what just having conversations in like as a normal human with other normal humans to normalize certain things and yeah, like I can imagine any of these being a
The importance of
conversation.
fighting stigma is so
Yeah.
important in this moment,
Yeah.
and I always talk about the importance of being a resource for your community. So, that does not mean you need to know all the things. No, 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 no. That means your friends know that they can come to you and ask you, and you may be able to point them in the right direction. There is so much mis and disinformation out there. If somebody comes to you and wants to know where can I find the closest abortion clinic? You know, you can point them to I Need an A or to Abortion Finder. You didn't need to know that the closest clinic is actually located here. You know that if you point them to this resource, they can get all the information easily and factual, and it will help them find an actual abortion clinic and not an anti-abortion center. um and so things like that, like making sure that you know where you can point your friends is important. And also, if you are comfortable, have engaging in conversations when you hear mis or disinformation, and like gently pushing back. I think this all depends on your level of comfort, right? That
Yeah.
does not mean you need to engage your most anti abortion or anti reproductive health relative, but if something comes up and you can gently, you know, correct them. I or like my mom has come to me with, "Hey, I hear there Wisconsin is considering trans sports ban for women in sports. This doesn't feel quite right to me. Can you like explain to me like what this actually is?" And so being that person who can have that conversation in a way that is helpful is really important for people, because there are so many people who maybe just don't have all of that information and just need it clarified for them, and that can make a huge difference of having those kitchen table conversations.
And for anybody who is listening to the audio replay of this episode later, the URL for the merch store is tinyurl.com/reprosfb merch. And of course, in the audio version, this will be in the show notes. No show notes for the live stream. Sorry, guys. Uh, but yeah, I love this idea of being a resource for your community. That might even end up being the title of this of this
Yes.
episode, because it is something that feels attainable. And I think that all of these conversations have centered around this feeling of being so overwhelmed, and the problems are so big on such a massive level. And I a previous guest that has been on this series, Jen Briney, who is the host of Congressional Dish podcast, I heard her say, wait, was it Jen? Hold on. Let me think for a second. Um, Man, now I can't remember who I was listening to. Oh, this is terrible. I'm gonna have to make an editor's note later. But they said, oh no, I know who it was. Okay, Jen Briney, awesome guest, Congressional Dish. Definitely listen to that show, talking all about what's happening or not happening in our legislative branch of government, i.e., Congress. It was the Money with Katie show, and she had a congresswoman or senator on recently. Man, look at me trying to tell a story, and
Process in real time, right?
I have no facts correct on this. This was not something I planned to talk about, but it was the Money with Katie show, and she had on, it was her episode that just came out, so I'm gonna look it up because we can do that. Um, why did she not put her name in the title? Understanding the Big Beautiful Bill's repercussions with the highest ranking woman in Congress, whose name maybe I will have to find later. I'm wasting a lot of time looking this up, but I want to get it right. It was Money with Katie, Money with Katie, Money with Katie. Representative Catherine Clark. So the
Oh,
Money
yep.
with Katie show with Representative Catherine Clark. She had her on the show, and uh, she said, you know, this is not going to be a direct quote. This is paraphrasing because obviously my details are all screwy. But she said, you know, they keep telling us to vote and to show up and to contact Congress and contact our representatives and tell them what we want. And we do that. And yet these things are happening. And I have to tell you, I'm feeling very disillusioned and feeling very not represented. And I don't know what to do about that when this is the remedy that we're being given is vote, contact Congress, tell them what you want, write letters, show up, make your voice heard, and I have never felt less represented in my life. And I'm thinking of just like being a resource for your community, like that feels attainable. That feels like a choice that you can make that doesn't have any gatekeepers.
Right, that's why abortion funds are great. You are doing direct support. There are practical support networks where maybe you are funding a diaper bank or something like that, where you are making sure people are getting the care they need. And I all politics is local, right? So also thinking of ways you can get involved with your local school board, right? That could be have things related to sexual and reproductive health in that book bans. What books are being banned? Are there things about with LGBTQ themes that you want to make sure are not being attacked? Are there uh book bans, sex education? What kind of sex education is your school district offering? So there are ways you can get super local and care and fight about those things at a local level that are really important. It's so easy to get caught up in the national politics of it all because this all feels really big and national, and important conversations are happening at the national level, but there are absolutely things you can do locally, engaging with the city council. Like maybe they are putting in place, we've seen some cities set up like abortion, like city abortion funds to help people access care, or some cities trying to fight and have like their own de facto like abortion ban stuff. So like there are multiple ways you can engage in so many local places, and especially talking about sexual and reproductive health policy, so much of that is happening at the state level versus the national level. And so one of the ways you can see that is by looking at our annual 50 state report card that we do that looks at sexual and reproductive health. Thank you. She put the link up, but for those of you listening, it's reportcard.reprosfightback.com. You can go and see how your state is doing. We have a really fun new interactive map this year. So you can see what your state's overall grade is, or if you want to see how they're doing on sex ed, there's like a little toggle on the side. You can click on sex ed and see how your state is faring compared to other states on sex ed. It covers everything from like sex ed to does your emergency room or does your state require, if you are a victim of sexual assault and go to the emergency room, are they required to tell you about and give you emergency contraception? Has your state expanded Medicaid? Does your state have a Medicaid family planning expansion? What kind of abortion restrictions does it have, or gender affirming care bans for minors? A whole lot of things. I think there are 13 indicators. Don't quote me on that because my brain's not 1,000% right now, but I think there's like 13 indicators you can look at to see how your state is faring compared to other states. And so no state is perfect. So wherever you are living, there are places you can see where you can push your state to do better.
Come on, Illinois, a B plus.
Hey,
I
that
was a
they've gotten
straight A
better.
student in high school, and I need A's, not B's.
Okay, but do you see that pink state in front of it on top of it that is definitely an F? That is where I'm from. That would be Wisconsin.
Also, can we talk about some of these have an F minus? I didn't even know that was possible in school.
Okay, so to be fair, we give pluses and minuses for things that are not considered in the report card, but may
Okay,
impact sexual and reproductive health. So let's say a state has a statewide fund that covers that lets Medicaid pay for abortions. That would get a state a plus. Or let's say the state has a law that says it can't talk about LGBTQ issues, that would get a state a minus.
I
So it's
see.
not covered in the report card, but it is terrible, so they need to get a ding for it.
So if you're looking at this tool and you're like, my state is doing terribly, what do you do with that information?
Yeah, talk to your state representatives and make sure that they are aware. I mean, there are states where you there are things where you would be shocked. I am shocked every year I do this report card that Massachusetts does not mandate sex ed.
Hmm.
Every year. That just
Hmm.
blows my mind that the state you think of as this blue state actually does not mandate sex ed. So, you can, like, hover over it, and that gives you the overall. If you click on the state, you'll go directly to that state's release, and you can see all of the information, or
Oh,
you can
wow.
toggle on the indicators. I
Okay.
love this. We've done this for 13 years. It's, I think, a really great resource that lets you know what is happening in your state and shows you places where your state can improve.
That's incredible. You had sent me that link and I hadn't actually looked at it ahead of time. Um, Super impressive. I'm going to fall down a rabbit hole after this conversation.
I know there's so much information on there. Like I said, there are so many different indicators to look at. Sexual and reproductive health, again, covers a really wide range of things, and we tried to get, a fairly wide sample. Um, but yeah. But I think the overall big message is we're doing bad, y'all. Like, I think there's 26 states failing. Like, that is not good.
Yeah, there was a lot of pink on that map. Um, Quite a lot. Um, so we talked about how Trump 2 is worse than Trump 1.
Yeah. Like, bigger, right? They were just like bigger and bolder. Like, how can we break stuff so much worse? Let's not just defund the United Nations Population Fund or, gut family planning funding. Let's just get rid of USAID. Let's attack DEI at all levels and all of the fallout from that. Let's completely say, like, transgender people do not exist and get rid of all of their rights. Like, this is just, there are just so many places, and it's really hard to not fall into despair or apathy. But that is a tool that they are using to make you give up. So do not fall into that trap. Find the areas you care about and take action in those areas, and find the joy in the moments where you can, and fight back joyfully, because they are trying to take away your joy and they are trying to take away your hope. Because if you do that, if they get rid of your hope and get rid of your joy, you will not fight back and you will just accept what is unacceptable.
The podcast again is called RePROS Fight Back. The website is reprosfightback.com. Of course, you can find the podcast in your favorite podcast app, in all the places. You can hear more from Jennie and her colleagues and collaborators and people who are really doing the work to move reproductive justice forward, to provide better health care for more of us, and to push policy in the direction that I personally think, and we all know my opinion is the most important one that matters because this is my show, that
Exactly.
pushes it in the direction that we want to see. Um, Jennie, this has been a frustrating and also enlightening and also delightful. I'm like, it's hard for me to say like, oh, I hope you
This is how I
enjoy my
feel at the end of my
conversation.
episodes. Yeah.
I hope you
Thank
enjoy
you
this
for such a great
conversation.
conversation about terrible things.
Correct. Correct. But no, I do not feel like I need to go lay down for an hour after this. So that is a good sign.
Yay!
That is a good sign. Um, is there anything else that you want to share with our listeners before we kind of wrap up here?
No, just thank you all for being here today. It was so wonderful to get to talk to everybody about something that I am very clearly passionate about. I would love if you would like to check out RePROS Fight Back. I think we have really important conversations. And again, we'll give you ways that you can fight back and get involved to make a difference.
Awesome. For all of our viewers and listeners, you can find the full Creativity and Media as Resistance playlist on YouTube at bit.ly/creativity as resistance, or you can just find The Creative Imposter on YouTube and the playlist is there for you. It includes all of the replays of it includes all of the replays of the past live streams that we have, as well as some upcoming sessions in August. And then, of course, if you are more of an audio person, the episodes are coming out a few weeks after their live stream as audio only in your favorite podcast app at The Creative Imposter. And we are actually looking for new guests for September and October. I said that I was going to keep this series going as long as I had people who wanted to talk to me about it, and as long as I felt like I needed to keep reminding myself of the great work that is being done by people like Jennie and like our other guests. And so if you have somebody in your sphere who you see using creative means and media platforms as resistance to the current socio-political climate with this current US administration, I would love to know what they're doing and find out more and see if they would be a good fit for the show. And Jennie, I am so sorry that we did not get to see the other kitty. I
I know. Sorry,
feel
y'all.
I feel a little bit bad about that. Um,
I think she's sleeping in my bed.
but I'm grateful to you for sharing your time and your insights with us. And I'm sure I will be seeing you again real soon.
I'm sure. Thank you so much for having me again. I had so much fun talking to you.